Welcome everyone to today's webinar, which is about the COVID Longhaulers Advocacy Project. And with us today is PN Medical's Chief Clinician, Betsy Page, who is a speech language pathologist. And our guest speaker today is Karyn Bishof. Karyn Bishof is a graduate of the Florida Atlantic University, where she did a bachelor's in exercise science and health. She's a former physical education and health teacher, director of athletics and coach, and also a former firefighter and paramedic. However, she has since lost her job after the COVID infection. Karyn is a 20-month long hauler as of today, leaving her with over 85 symptoms and many new medical conditions. She is the founder of the COVID-19 Longhauler Advocacy Project and co-founder of the Long COVID Alliance. Thank you so much for being here today and talking with us, Karyn.
Thank you for having me.
So Karyn, your life has changed completely since you've had COVID. And tell us a bit more about your personal journey first, please. When you contracted COVID, how bad were your symptoms in the beginning and what were your expectations? What did you think would happen?
Sure. So let me just give a brief overview to everybody. Long COVID is basically when you get COVID-19 and you experience lingering symptoms. Sometimes they begin to get better. Sometimes they stay constant. After about a month's time, some people are reporting symptoms coming back and experiencing relapses and flares. So at this point, we're looking at 3 months after COVID infection. If you have prolonged symptoms, which we've identified over 200 for related to long COVID, you are what is now called a long hauler. And you experience long COVID, which is the patient preferred term. But the medical term floating around these days is post-acute sequela of COVID-19, PASC. So when I first got COVID-19, we didn't know that it was anywhere around. I'm here in South Florida. I was working as a firefighter paramedic at the time. This is mid-March, and all we knew about were the people who were sick in the nursing home up in Seattle. I ended up getting sick along with 6 of my coworkers. I would say I had a mild to moderate case, which I fought at home. I experienced the typical symptoms, which were fever and cough, slight shortness of breath. I had this extreme fatigue, headache. I never got like the muscle aches that a lot of people get, but I definitely had some nausea and vomiting and GI issues. Fast forward to maybe like week 3 or 4 post-infection, I kind of started like I was feeling to get better, but noticed that I was struggling more than the others who got sick at the same time as me. Then week 6 to 8 came and I kind of just got smacked down again. All of these new symptoms started. Some of the symptoms that I had got rid of during acute infection returned and had different varying levels of severity and like weren't really correlating with one another. And it was very hard to understand at first. And it's still hard to understand to this day because now at this point, 20 months later, like you said before, I still suffer from over 85 symptoms. I've been diagnosed with over 15 new conditions, many of which are chronic and I will have for life. And I just want to, point out that I'm not alone. This is not uncommon. We're looking at anywhere from a conservative range of 30 to 50% of people who develop long COVID. And just to be fair and note that there are varying levels of long COVID. There are some people like me who spend the majority of their time stuck in bed, unable to work in any capacity with all these new medical conditions and symptoms. And then there are other people who maybe have 1 or 2 symptoms, but they're still able to work full time. They just have not regained like full sense of smell, or they're still suffering from headache or something like that. Not like a whole comprehensive, every single body system is still experiencing issues going on. So for me, I expected to get better. I was healthy. I was young. I was a firefighter paramedic working out 5 to 6 days a week. I was an active single mom. And I thought, okay, maybe like a couple more weeks, maybe I'm just a straggler. And then a couple weeks turned into a couple months. A couple of months turned into now approaching almost 2 years. So I really just want to emphasize the fact that there's a lot more to COVID than life or death, and that there is this huge area in the middle of disability and significant loss of quality of life. And that's something that people should really be considering.
Thank you for sharing your personal experience and for taking it a step further into, founding and co-founding the advocacy group. Mm-hmm. Based on the collective experience of the members of the advocacy group, what trends are you seeing in the community regarding common symptoms and diagnoses?
So one of the first things that I will point out is that long COVID primarily affects women. We're seeing about 80 to 85% of long haulers end up being women. And we see that trend across the other chronic illness communities for autoimmune diseases, POTS, ME/CFS. So that's definitely something that we have to better understand in post-viral illnesses and in these other chronic illness fields. We're seeing the same exact stats, so 80 to 85% who were never hospitalized, who had a mild case and were told to write it out at home, compared to 10 to 15% who were hospitalized. And many of those who were hospitalized are complaining of things more related to like long-term intubation and being on breathing machines and all of that kind of stuff, versus kind of like this syndrome-like experience that non-hospitalized long haulers are facing. And granted, both can experience each other. And then the most common themes that we're seeing is that long COVID is triggering all of these other chronic post-viral illnesses that we've seen before. They're not new. They shouldn't have been unexpected. But we're looking at things like POTS, which is postural orthostatic tachycardia syndrome. So that is typically when somebody stands up, instead of their heart rate and their blood pressure responding normally, they're dealing with dizziness and possibly syncope or pre-syncope. They're dealing with nausea and vomiting and all of these other symptoms, tremors and GI issues that come with dysautonomia. So POTS is a form of dysautonomia, and dysautonomia is basically the dysregulation of the autonomic nervous system. And for those who don't know what that is, think of it as everything that your body does automatically without you thinking. So your digestion, your heart rate, your blood pressure, you never think I need to digest my food. There's a whole body system that does these things for you. So in dysautonomia, this entire system is dysregulated. People can't regulate their temperature. They have issues with eating meals. They have issue with maintaining their heart rate and their blood pressure. And it leads to very debilitating issues. Then we have ME/CFS, which is myalgic encephalomyelitis and chronic fatigue syndrome, another highly debilitating condition where people just have zero energy and zero health to do their normal daily activities. Many are usually bedbound, many are unable to work. This is not just feeling fatigued. I'm tired, I worked a hard day. This is beyond any explanation of profound chronic fatigue that people cannot get over with any amount of sleep. This leads to issues like chronic body pain. And this is another condition that has been very overlooked for decades, and there is not a lot of help for. We're also seeing small fiber neuropathies and other forms of neuropathies in chronic pain conditions. We're seeing autoimmune conditions, with the most common being lupus, Sjogren's syndrome, rheumatoid arthritis, sarcoidosis, and antiphospholipid syndrome. We're seeing MCAS, which is mast cell activation syndrome. And we're also seeing hypermobile Ehlers-Danlos being diagnosed in long haulers. And a lot of long haulers unknowingly are being tested for Ehlers-Danlos in general and coming back positive, which is something you're born with, but none of us knew we had prior to getting COVID. So COVID seems to have awakened all those issues with Ehlers-Danlos, which can potentially be the source of some of the chronic pain that long haulers are now dealing with as well, potentially indicating that connective tissue disease may be a predisposing factor to becoming a long hauler. And there are quite a few studies going on about this right now.
It feels overwhelming just to hear. I can only imagine like living this. And so then I think the next question is about treatment. So what do you think are the biggest obstacles that prevent long haulers from receiving targeted care and treatment?
I think the first issue that came up is a delay in collecting data, because in the beginning they were excluding people without tests, not understanding how severely impactful that was to identifying long haulers. Because many did not have access to testing in the beginning, or if you're familiar, like there were 3 symptoms that you had to get tested. And if you didn't have all 3 of them, you didn't qualify to get a test. So as we've evolved and as we've moved on, we've gained all these long haulers, many of which have not been recognized. So that lack of collecting data from them in the beginning has delayed where we are now. We are still trying to collect data and figure out what is the prevalence of long COVID? What does long COVID look like across the population? Does it vary in different ethnic groups? Does it vary in different age levels? And the answer to that is really no. And does it vary in children versus adults? Sadly, no. Our children are looking just like us. They're developing all of the same conditions that we're developing: POTS, MCAS, autoimmune diseases, small fiber neuropathy, ME/CFS. So just like we can't go to work, these kids can't go to school. And that's very impactful to the family unit as a whole. But, going back to treatment, if you don't have the data and you don't know how many are there and you're not fully understanding the pathophysiology, in addition to the lack of post-viral research that's existed in the past, we're really in a place where we're almost starting from scratch, where we should be building on existing post-viral research where it exists, especially given that long haulers are receiving these very clear diagnoses of these other chronic illness conditions, where while controversial at this time, I honestly believe that long COVID is kind of going to be known as a collection of these conditions that people are developing, especially until we find a very obvious pathophysiological trigger in what causes long COVID. So I have to emphasize that there are a lack of specialists in these fields that we need. There are lack of facilities and medical sites that are capable of handling the testing that you would do for these conditions. And there's still a lack of funding and research in these fields. So one of the things that we're really trying to do is get the younger, population of those entering med school to start taking interest in these fields, to start expanding on these kind of overlooked fields that now, before the COVID-19 pandemic, the system who treated these chronic conditions couldn't handle them then. And now they have an influx of just millions of Americans who have become long haulers joining that. So we really, really, really need to overhaul and try and get more interest in these fields and more funding, because that is the only way that we're going to get treatment. And at the same time, so you might have heard of the Recover Initiative. That is coming out of the $1.15 billion that the NIH received from Congress for long COVID research. There will be over 200 sites in the US as part of that. However, while this is going to be the largest scale study on long COVID to date, with about 35 to 40,000 participants, there's going to be no treatment aspect of this. And they will not be looking into clinical trials for about a year to a year and a half after the study begins. So again, in the interim, there's really no treatment for long COVID other than trying to treat the symptoms, which doesn't treat the underlying issue. So even with treating the symptoms, many of us have extremely poor quality of life and are still unable to work. So we are really, really desperate for that underlying pathophysiological trigger to be identified so that we can find a targeted treatment.
Yeah, I hear you that the underlying dysautonomia is really, really under-recognized. We had another webinar on this with Dr. Gabo, who was actually specializing in dysautonomia, and kind of really pointed out how many decades this has just been ignored, really. But you talked about the lack of data that there is. You did actually want to do something about it and also kind of get people together. So you founded the COVID Longhauler Advocacy Group. Tell us a little bit more about that, what it is for, who's part of it, why did you found it, how did you found it?
Sure. So, like I said, I was one of the earliest infected with COVID-19. So therefore, I was one of the earliest to notice that something wasn't right. I wasn't getting better. At that time, I didn't know that there was anybody else out there besides myself. I saw this article by Ed Young in The Atlantic, who mentioned an online group, which I checked out. I started asking all of these questions, especially because I was, fighting with my employer about termination and being sick and all of these other things. So I'm asking all these questions like, who's still sick? How long have you been sick? What are the symptoms that you're dealing with? What are your doctors saying? And hearing people's responses, that prompted me to create our first studies that we did, which we collected 1,700 responses from Longhaulers in June and July of 2020, which was really one of the first things that were reported out to the long COVID community and really made them feel validated and made them feel like they weren't alone and that like somebody is like finally looking into this. So we continued to build on the surveys that we were doing. And out of that, we ended up creating our group, which is the COVID-19 Longhauler Advocacy Project on Facebook. We have since done a lot of work. I mean, we formed our state advocacy teams. We have a state chapter for every state in the U.S. We have special populations groups. So, for example, a first responders and military group, a group for educators, a group for long COVID teens, pediatrics, and healthcare providers. We did Long COVID Advocacy Day with Solve ME back in April 2021. So we spoke with lawmakers. We were trying to get them to understand what we were going through and connect them with their constituents and show them that this is happening in your backyard. Trying to get them to understand that the need to support long COVID bills like the Longhaulers Act. I served as a patient representative, as did many of our members, for the Recovery Initiative, where we helped develop the protocol for the Recovery Initiative. We've done webinars and educational series. We've created a ton of resources for our members. We also have the most comprehensive guide to date for Longhaulers. And then on the policy and research side, we've done 6 studies. One is published, one is pending publication. We lobbied Congress for the $1.15 billion from the NIH. We started creating this COVID competent providers guide, trying to get people to add COVID competent providers to a list for easier access to other long haulers because of the extreme level of medical gaslighting patients are unfortunately still facing. And because so many of us are not working, that we can't afford going to 3 or 4 doctors with the copays and things like that. So we're really trying to help each other collect like the experts, if you will, in our areas and spread that information. We provided language for the Longhaulers Act, the Pandemic Centers of Excellence Act. There is a 9/11 style investigative bill that's out there as well. And then we have our multiple member level meetings, the majority of which are confidential at this time, but we continue to talk to people about our needs and our experiences and how they can help long haulers, both in their district, but also across the nation.
That's a lot of work.
For sick patients, yes.
Yes. And I just have to say thank you for taking all of that on. For our audience, what do you think is an important take home to understand about long COVID? And is there anything you would urge people experiencing long COVID to do? Yeah,
so, like I said earlier, long COVID is not something that you're going to be dealing with for a month or two. The thought process in the beginning that we were all told was just give it time, you'll get better. But the reality is that those of us giving it time, especially those of us from March and April, are actually getting worse. We're not getting better. there's more than life or death to COVID. There's this interim, this middle ground where people don't realize the level of disability. They don't realize how much quality of life they're going to lose, but they also don't think about how it affects their immediate family. So like, I'll talk about this from the perspective of like a mom, a dad, and a child. Sometimes the child becomes a long hauler and mom has to stop working to stay home and care for the long hauler. Sometimes mom's a long hauler and dad has to stop working or work part-time to help mom out at home more. So people are losing incomes, but some families are losing more than one income or, not making the bills that they were once able to make. Some that have lost their jobs have lost their medical insurance and aren't seeking medical care. I can say this from my perspective as a single mom, that it's just me and my son. When I'm sick in bed, there is nobody taking him to the park. There is nobody riding their bike with him. There's nobody going to his soccer games. It is just me and him. So if I am down for the count, he is now losing out on things in his life. Even for schoolwork, it's hard for me to try and help him. So I need people to really think about long COVID as something that affects everybody around you, affects you, can affect your finances, your home, your health in general, because we know when people are stressed about finances, it negatively impacts their health as well. And we really, really definitely need financial assistance for long haulers and a lot more facilities and a lot more interest in long COVID to start getting down to potential treatments and clinical trials and ways to restore some aspect of quality of life for us in the interim until the golden ticket is found, if it is ever found. But that is what we need people to realize, is that this might not be a couple week thing or a couple month thing. Some of us are approaching 2 years. Nobody anticipated 2 years. Those of us who had a cushion early on no longer have that cushion. So we're out of options and there is nothing in the works. You don't want to get COVID-19. You don't want to become a long hauler. You want to protect your family and yourself as much as possible. And, if you happen to have a long hauler friend or family member, point them to the resources that can help them and, offer them assistance or help in whatever way they can. A lot of the times we're going to tell you we don't need it, we're fine, but we really do need it. So reach out to a friend or a family member that has long COVID.
Thank you, Karyn. So the key really is trying to prevent getting infected in the first place. For those who have long COVID now, who are long haulers, what's the best way to find the resources that you were talking about? How can they contact your group? How can they get in touch with you? How can they find all the data that you provide, the resources that you provide, treatment options? Where's the best place to go to?
They can visit our Facebook group, which is COVID-19 Longhauler Advocacy Project. We're also on Twitter. It is at C19LH_advocacy. Our email is C19LonghaulerAdvocacyProject@gmail.com. The Facebook page is where it's happening. It's where everything is going on. And all of our resources and documents are also on our Facebook page and will be embedded into our comprehensive guide for COVID-19 long haulers and providers. That is the most comprehensive thing to date. If anything, I encourage everybody to look for that document, print it out, review it, give it to your doctor, and save the link, because we keep that link live. We don't upload it as a PDF because I continue to add to it as new information comes out. So I want everybody to have the most accessible, up-to-date link. So I keep that live. And, we listen to our other chronic illness community partners who will also continue to send us updated research on their end for us to share with the long haulers who have now basically become part of those communities as well. So all of our resources are on our Facebook page. They're in our master document is what I call it. So definitely check that out and shoot us an email. We'll send it to you as well.
I've looked at some of the resources that you shared. They are really comprehensive and they're really, really helpful for anybody affected, but also for caregivers, for physicians, for anybody looking after long haulers.
Karyn, thank you for spending some time with us to do some question and answer as well. First question we got says, my first question is not a question, but a comment. Thank you, Karyn, for being very early aggressive advocate for long COVID patients, not just a supporter, but a real educator for patients as well as their doctors and medical teams. You are my hero. And I would say at PN Medical, we would second that. The real question, most doctors expect to hear a complaint of fatigue and brain fog from patients with long COVID. But I have a question on an underreported symptom of balance impairments. Based on physical therapy literature regarding the importance of the diaphragm as a postural stabilizing muscle, and knowing that weakened diaphragms are often a presentation of COVID, PTs are now routinely screening long haulers for balance deficits. What's your personal experience with balance issues, if any, and what are you hearing from your constituents?
So the balance issues really are not that common, other than when long haulers are talking about them in terms of the dizziness and the vertigo that we experience that is largely due to the orthostatic intolerance that we deal with. In addition to that, there are a lot of people dealing with muscle weakness and muscle atrophy from being stuck in bed and not being active for so long. I personally participated in a vestibular test that was being done here at Florida Atlantic University. I was able to pass the test that day, but then there's other days where I'm walking down the stairs where I'm dizzy and I miss a step, and I actually ended up hurting my foot and rolling my ankle back in February this year from missing a step. I wouldn't say that it rises to the level of those that have experienced strokes or TIAs and things of that nature. I wouldn't say that these are a constant everyday experience for long haulers, but I can note that when we're going through flares, when we're going through a day with bad symptoms where none of our medication is helping those symptoms, when we're dealing with relapses, these are things that pick up. And I think that that's something that doctors should be looking at, is how do things respond when my patient is active, whether it's physical or cognitive? Are they experiencing post-exertional malaise? Like when their symptoms tick up, is it exacerbating some of the other conditions? Is it leading to more confusion? And things like that are things that doctors can help educate their patients on in terms of pacing and learning what's in the realm of being safe to do and not safe to do, and planning your day out or planning your week out, not overdoing yourself so that you don't end up crashing in bed for days. So I think a lot of, like, going back to the balance issues, a lot of it has to do with the overload of our bodies in that day, in that moment. And again, for those that have had like something like a stroke or a TIA that have like permanent deficits, I think I'm comfortable saying that experience is a little bit different than what we're experiencing for the syndrome-like issues for those of us that haven't had permanent deficits from something like a stroke.
Yeah. That goes along with what I remember hearing from Mount Sinai when they were talking about post-acute COVID syndrome and just the importance of that window of energy and staying within that window to avoid, the post-exertional fatigue later or other functional fallout.
Yep.
Another question. Thank you for sharing your personal case and knowledge so openly. Did you get the vaccine and did it reduce your symptoms? It's reported that the vaccine has helped some reset their immune system from long haul.
Tricky subject that nobody likes to really talk about. But in the long COVID community, we've really been trying to monitor this amongst long haulers because of how overactive our immune systems are and because of these cascading effects of developing all these secondary conditions. The numbers for those who get better and get worse after vaccination are basically dead even. Unfortunately, those that were reporting feeling better had a small window of feeling better. So the majority of those people did not end up staying better, which it does tell you that the vaccine is doing something, it's touching something. But then again, you face it possibly being this placebo effect because everyone hears it in the media. Everyone hears, oh, some people are getting better. For the people that got worse after the vaccine, there are a good handful of people who have remained worse. The majority of people get worse, I would say, in for a couple of weeks or a couple of months. I can say from my personal experience, I did not get vaccinated until August, which is when I got my first vaccine. I had a horrible allergic reaction to the vaccine. It worsened my myocarditis. I ended up having to go through all types of cardiac testing again. But I am somebody who already had a history of myocarditis from COVID-19. So, these were things that we were kind of expecting to happen in the allergic reaction from the MCAS. My POTS symptoms dramatically got worse. I was very, very, very sick. I did not end up getting my second vaccine until not this last weekend, but the weekend before. After that vaccination, I ended up having some really bad neural issues for about 3 days, but I am back to my pre-vaccination, my pre-second shot long COVID baseline. So there are people that get worse. There are people that stay worse. There are people that get better, and there are some people that stay better. So I want to just talk about, the vaccine is not a cure. For some people, it may work. We don't understand why. For some people, it makes them worse, which we think may just have to be with the level of inflammation. Like it's kind of like a secondary insult to what we're already dealing with on a daily basis. And both of these are fair assumptions, and both of these should be expected. It's just a matter of monitoring the long hauler, knowing what their current symptoms and issues are, and then following them closely post-vaccination, because there have been no studies on the vaccine in long haulers. And this is one of the things that we're pushing for to be included as part of the Recovery Initiative screening for the study that they're doing.
Okay. I see you answered in the chat, but I'm going to say it out loud for the recording as well. Someone asked, we're getting worse, not better?
Yeah, so a lot of the things that we were told in the beginning, like, just go home, relax, you don't need to go to the hospital, or give it a couple more weeks. That turned into give it a couple more months, to now many of us are approaching 2 years of being sick with this. And there's something about this March, April 2020 group of long haulers who kind of differentiate us from the rest of the long haulers after us, in terms that we do have more neuro issues. We are the group who's actually getting worse after vaccination, and we are the group who's getting worse in general and developing all of these other conditions so quickly and in so many numbers. So this March to April group is really a group of long haulers that's essential to the research. We are first wave long haulers. We are dealing with probably the original or only the first variant of COVID at that time. So part of what we also want researchers to be looking at is, are certain variants responsible for causing certain different levels of the illness or certain different groups of symptoms? So those are answers we don't have, but there's absolutely something about this early group of people who got worse. And it may end up being that we just never received care for like 6 months until everything died down. Whereas people now who are getting infected have earlier treatment, have access to monoclonal antibodies and, pharmaceuticals that we didn't have at that time. So that's also a very likely potential as well.
Yeah. Another question that is coming in is, are you seeing referrals to therapy? So when you mentioned like energy conservation and work simplification, right away, many of us think about physical therapy or occupational therapy. Someone else had an experience where they went to speech therapy for some cognitive treatment. What are you seeing?
So a lot of long haulers will struggle with the PT, OT simply because they can't get themselves there, and they can't commit to how they're going to feel and make sure that they're, there for attendance. And then to get there and think of a PT session for the average person, even for your elderly geriatric population, it's still too much for long haulers. So doing PT and OT is very hard. There's been a lot of advice for people to do like recumbent exercises like you see in POTS. But then for those who struggle with ME/CFS and post-exertional malaise, you run into a roadblock. So these people are stuck between one condition where they need to exercise and they need to get some physical activity, but then they have another condition that completely lays them out and keeps them in bed anywhere from days to weeks to months. And then as far as speech, I think speech therapy has been one of the highest referrals over PT and OT because of the cognitive issues. And just to notate, a lot of long haulers are starting to have issues like we have not only word recall, but like we're having issues with swallowing, and we have like a lot of swelling, and we're choking on our own saliva and spit, and we're having like regurgitation and developing like aspiration pneumonia. And I'll just speak to myself that after colonoscopy, endoscopy, they found that I have eosinophilic esophagitis. I wrote that into the group, and a bunch of people ended up saying, I just got diagnosed with this too. So I think that's something that speech therapists and ENTs should be considering when they're looking at long haulers. And again, I mean, we're looking at this chronic systemic inflammatory state. Why wouldn't this be in the realm of possibilities? So a lot of speech therapy for both the dysphagia and like the choking and, you know, potential sleep apnea as well, which, you know, it is hard to do and figure out if people aren't doing sleep studies. But at the same time, it's helping with like the word recall issues and the speech impediments and the slurred speech. And like a lot of us are dealing with like dyslexia now, and like everything is just kind of mixed up for us. And it's very frustrating, in addition to a lot of the time speaking, losing our thoughts mid-sentence, which is very reminiscent of like dementia and Alzheimer's. And with the number of people having cognitive issues, and while it's seldom, there's a lot of people like being found to have like small lesions in the brain after like long COVID or after COVID that they didn't have, you know, a couple months or years before long COVID if they had prior imaging. So we don't know what we're being left with. And like I said, this recovery initiative is going to be 4 years, but I am hearing that there's already plans for like a 10, 15, 20-year follow-up in the long COVID community to see if there's anything like in the future, like, are we more prone to heart attacks? Are we more prone to COPD or emphysema? Are we more prone to clotting disorders or something like that? So while it's early, I think it's imperative to have all hands on deck to identify these issues to better create the framework of what we're looking for and trending moving forward.
Yeah, I so appreciate your time today. You're so well spoken and passionate, and doing all of this while suffering long COVID, very admirable. And I just really appreciate everything that you're doing. And I hope that everyone got their questions answered. When we post this for on-demand viewing, we will have all of those links that popped up on the screen. We'll have those right there so that you can click through. Thank you so much, Karyn.
Thank you.